Hi, my name is Kate Brown. I'm a UAM nursing student, and today I'm just going to be taking care of your tracheostomy. So can you please tell me your name and your date of birth? Okay, so first I'm just going to put this towel over your chest. And now I'm going to put on gloves. And I'm going to remove the old gauze from around the trachea. And I'm going to dispose that in the biohazard bag. So at this point, I would take off these gloves and put on and perform hand hygiene and put on new gloves with PPE. And then I'm going to open this up and set up my sterile field. And dump all this. And I would take normal saline and lip it and then pour it into the container. And then I'll take hydrogen peroxide and I'll pour that into the other side and dispose of that in the biohazard. And then I'm going to take the gauze and I'm going to put half of them in the normal saline. And then I'm going to take the cotton swabs and dip those in the normal saline and put them to the side. And so now I'm going to take out the cannula and I'm going to soak that in hydrogen peroxide. And I'm going to take it out and clean it with the brush on both ends and dispose of that. And then dip it in normal saline and tap it off and place it back in. And you push it down till it clicks. There. And then now I'm going to take the swabs and I'm going to clean around. Using it one time and discarding it. And then I'm going to take the gauze that were in saline, and I'm going to wipe around. And I'm going to take dry gauze and just dry it off around. Okay. And so now I'm going to take off the old stabilizer. And I would ask the patient to lift up their head and discard of that. And then grab the new stabilizer. And then ask the patient again to lift their head. tie that back. And then you put your 2 fingers underneath to make sure it's not too tight. Okay, and then I would discard of these gloves and perform hand hygiene and put on new gloves. And I would grab the new gauze, pre-cut gauze to put underneath. Okay, then I would take off the towel and I would discard all of this into the biohazard bag and take off all PPE and gloves, and then I would make sure the patient's in a low position and the call light is in reach.